today I have the great pleasure of speaking with Dr. Pearse Keane, who is consultant ophthalmologist at London's Moorfields Eye Hospital and also associate professor at University College London. And today we will chat about transforming healthcare using AI, lessons from ophthalmology. So Pearse, how are you today?
I'm wonderful, Patricia. I'm really looking forward to this, and yeah, thank you for inviting me. It's an honor.
Oh, well, it's an incredible honor to have such a wonderful UCD alumni such as yourself to chat to today. So first question for our listeners, Pearse, is where are you located and what's keeping you sane while you socially isolate?
Well, I'm not sure about staying sane, but I'm at the moment, as you can probably see, I'm in my office in the hospital in Moorfields in London, but I live in North London in Finchley, and keeping me sane, also driving me insane perhaps, I've got two young daughters at home, a 5-year-old and a 2-year-old, and the only silver lining to this whole pandemic has been that myself and my 5-year-old Maya have started reading Harry Potter books together, and I think we'll always have that wonderful memory. And the nice thing, but also like causing me sleep deprivation, is she comes into my room and wakes me up at increasingly earlier times in the morning to get me to read her another chapter. And her current record is about 5:45 in the morning when she comes in. But one nice memory, I think, from this craziness that we're having to deal with.
Well, that's very sweet, Pearse, and thank you so much for sharing that with us and our listeners. So just to talk about your work now, Pearse, I'm just wondering, maybe you can tell our audience what you do and what makes you so passionate about it.
Well, so as you said at the start, so I wear two hats. I'm a consultant ophthalmologist at Moorfields, the oldest eye hospital in the world, and I treat retinal diseases like macular degeneration and diabetic eye disease. I'm also a researcher at the Institute of Ophthalmology at UCL, and I lead a clinical research group which is aimed at developing and applying artificial intelligence in ophthalmology and in healthcare more broadly. And then the other thing is that you know, my work has had some prominence in recent years because I initiated a collaboration between Moorfields and our AI company DeepMind, which of course are owned by Google and Alphabet. And so, you know, I feel quite passionate about the work because, you know, it's a chance to try and publish some groundbreaking research and, you know, publish in a journal like Nature Medicine and the like, but also, perhaps even more importantly, to try and see your work translated to be used in millions of people.
Wonderful. Well, that's incredibly noble, Pearse. And from everything you've just said there that we've touched upon, it sounds like interdisciplinarity plays a very strong role. Would that be true in your work?
Yeah, I mean, this is the thing that I probably feel most passionately about, and why I just love to speak at this session, Patricia, and to meet you, because I'm in a very fortunate position in the UK that I'm funded by UK Research and Innovation, UKRI, as a Future Leaders Fellow. And this means that I have 7 years of funding. And it's a new funding scheme that is specifically aimed at projects that are ambitious and adventurous. It's flexible, long-term funding, and it's specifically at the boundary between disciplines and at the boundary between industry and academia. And for me, that's where we can really get stuff done.
Wow, that sounds incredible. I think the Irish government could learn a lot from looking at that program as well. But that's, I'm sure we'll have lots of questions from our audience about that. That sounds very exciting. So please, audience, please remember to submit your questions via the Zoom for Thought chat function at the bottom of your screens. So I suppose, speaking about the pandemic that we spoke about on the first question, COVID-19 has really changed everything across the world. So just wondering, what has it changed for your work and any unforeseen opportunities?
I think that there's been lots of opportunities and lots of positive changes that have come from this. So I think on the clinical side, at Moorfields, we've moved much more towards virtual and telemedicine consultations. You know, I think we're now the leading, or I think, the leading center in the NHS in terms of using the Attend Anywhere video consultation platform. Where so clinically, I think that's important. On the research side, you know, as I said, I lead a clinical AI research group, and I think one of the exciting things is that it's given great impetus to, you know, our research is all involving data sets on the cloud, and Moorfields has got its own research cloud, and I can give remote access to researchers from, you know, many different locations, access to that in a very secure, reliable environment. And I think that's the future in terms of clinical AI research.
Yeah, wow, couldn't agree more.
And I would say, so just to add, what I forgot to say is, this is so there's a real opportunity for patients here if we do this right in ophthalmology, because this is the chance to try to use new technologies and innovation to bring world-leading expertise out of the hospital into the community and into the home. And I think that should be the direction of travel for healthcare.
Wow, and what a great way to finish our 5 minutes of questions. So now there's plenty of questions coming in from the audience, and we'll try and get through all of them in the next 5 minutes. So some questions, lots of questions already in for you, Pearse. Here's one for you that you like. Why are you inventing a new eye exam?
It's a good question. I think, like for me, I'm totally biased, but I think ophthalmology has always been one of the most technology driven of all the medical specialties. So like in the 1950s, beginning to use lasers for diabetic retinopathy and lasers to remove your glasses, microsurgical techniques to remove your cataracts, stem cell gene therapy, etc. And so given that ophthalmology is such a tech-driven and imaging-driven specialty, we've got the perfect substrate for artificial intelligence. And I think the flip side of that is that there's a huge need in ophthalmology. And the fact is, you know, and some people may be surprised at this, in 2017, ophthalmology overtook orthopedics as the #1 busiest specialty in the NHS, in all of the NHS in terms of clinic appointments. Nearly 10% of clinic appointments in the NHS are for eyes, and that's nearly 10 million appointments per year. So it's huge numbers. And the problem is, like, we're drowning in the number of patients we need to see. And I'm sure it's the same in Ireland and in other places around the world. And unfortunately, there are people who are losing sight, sometimes irreversibly, because they cannot be seen and treated quickly enough. And I think new technologies and innovation and AI will play a role, at least in part, in addressing this problem.
Wow. Yeah, okay. And why? So is it just that people are aging, Pearse, that there's more issues with eyes, or?
Yeah, I think so. A particular problem in Ireland and the UK is age-related macular degeneration, or AMD. AMD is the commonest cause of blindness in Europe and North America and many other regions. And, you know, it's just with an aging population, we're seeing more of it. And there was a paper in the British Journal of Ophthalmology from Germany in November, which actually estimated the prevalence of early or intermediate AMD in Europe was 25% of those aged 60 and over. That's mind-blowing numbers, actually, as the population gets older. And of course, that's to say nothing of diabetes and all of these other chronic diseases.
Okay. So the need is really growing. Okay, yeah. I have so many questions for you, Pearse. We'll try our best to get through them, but here's one for you. So tell us the story of how you first contacted DeepMind co-founder, Mustafa Suleyman. I hope I pronounced that properly.
Yeah. So, I mean, one problem I have, being Irish, I can probably talk for hours, and I know this is short, but basically I was reading about all the latest advances in deep learning, and I was trying to figure out who to contact. And when I contacted people in university settings, back in 2013, 2014, they weren't really interested. And then I read a profile in Wired magazine in the UK about DeepMind, and I read that Mustafa was from London, his mother was a nurse in the NHS, they were based in King's Cross, and I thought, this is the person to contact. So I tracked him down on LinkedIn, took out a 1-month premium membership of LinkedIn just so I could send him a message without being connected. And I said, let's work together, and the rest is history. 5 years ago this month, actually.
Wow, fabulous. Such a fabulous story, actually.
Yeah.
Thanks for sharing that, and a great question. So next question for you. So actually, it's very complimentary. You've done incredible work in Moorfields DeepMind collaboration. You've shared over a million retinal scans with Google, but how do you approach privacy associated with people's data?
Yeah, I think that's probably the single most important aspect of the work. I mean, these were anonymized retrospective scans, but I think it's very appropriate that there are sensitivities around sharing NHS data with a company, and particularly if that company is a multinational tech company like Google. So we've really tried to be thoughtful in our approach. So from the start, we brought on all the major eye disease charities. We brought on the Royal College of Ophthalmologists. We dedicated a section of our website, which is still there, to the collaboration with FAQs. If you go to the waiting room in Moorfields, there's a screensaver which comes up every few minutes, which shows a picture about the collaboration and who to contact if you want to opt out, if you want to get more details, etc., etc. And I've given more than 200 talks in the last 5 years to the public about the collaboration. So really, really trying to do our best in terms of transparency, ethics, data protection, and just showing to people we're trying to do the right thing for the right reasons.
Great. What a great answer. Well done. 200 talks in the last couple of years. Okay, you've been very busy. Along with having 2 jobs, but okay, and 2 small kids, but okay, next question for you. If I am a medical student or a young scientist, how should I learn about artificial intelligence?
Yeah, that's another long answer, but I think for medical students and scientists and across all fields, I think one of the biggest areas is going to be automated deep learning. And I think that all of the major tech companies have these automated deep learning platforms that allow you, without having an engineering or computer science degree, to begin to get some public data sets and begin to train models and to begin to play around with those systems. I was fortunate to publish a paper in September last year in the Lancet Digital Health, which described the use of one of these systems. And so I would say just go and explore some of these systems, because I think we're at a stage with AI that's a bit like the 1970s in terms of computing, where we're going to move towards the democratization of this technology. It's kind of like when they started with the personal computer. And I think that's when we have biomedical scientists and doctors and other healthcare professionals really engaging. That's when we'll identify thousands of new use cases for this technology.
And actually, there's another question that came in very similar to it. I think you've almost answered it, but do you think to lessen the learning curve associated with these new technologies, it would be prudent to introduce any sort of coding or technological literacy into medical education?
I do to an extent, but bear in mind that there is already in medical school some statistics training, but for the most part, if you ask a junior doctor what sensitivity and what specificity, they'll struggle to give you an answer to that question. So if we're going to ramp that up a bit, then that's going to be challenging. But I do think that there is something, certainly for anybody joining my research group, I would like them to have some fundamental skills in statistics. It's the most transferable skill you can possibly have, I'd say.
Yeah, sounds great. And actually, I'm really sorry, we're running out of time, so we've time for one last question. So here's one for you. What will healthcare look like in 2030?
So I think, look, I don't think AI is going to replace doctors or other healthcare professionals. I think realistically, despite all the hype, 2030, we're still going to be super busy. We're just going to have new problems, and we're going to have to deal with information overload. So we're going to have 10 different types of imaging. We're going to have genomic, proteomic, metabolomic, sensor data, app data, and we'll need to use AI to integrate all of these information streams and make decisions for our patients and combine that with empathy and wisdom and all of those things. So I think it's a very exciting time. And one thing I'd just like to say is, like, I'm very biased, but I definitely am keen to build any links we can with Irish graduates, and particularly anybody from UCD. So please do get in contact. I'd love to hear from you.
Fantastic. Thank you so much, Pearse. I just wanted to take an opportunity to say a huge thank you to Pearse. So thanks so much.
Thank you. It's my pleasure.
Yeah, and fascinating discussion today. And also thank you to everyone else for joining in today. So we are taking a break from Zoom for Thought, from these short Zoom calls for the month of August, but we will see you back again in September. So please do check out our zoomforthought.ie website, or you can sign up to our mailing list at discovery@ucd.ie. So thank you so much again, Pearse.
Thank you.
Thanks. And thanks everyone for joining in. Have a great day, and see you all on our next Zoom for Thought. Thanks.